Right, you're
Oh,
good.
I need permission.
Go ahead. Should be good to go now, Edith.
Okay, we're recording now.
Yep, you're good to go.
Perfect. So this scholarly article highlighted the disparity across access to healthcare for Latinx women and exemplified how this is one of the many structures and systems that disproportionately disadvantage immigrant women. Numerous barriers negatively impact undocumented Latinx women's contact with the healthcare system. These are primarily socioeconomic, legal, and cultural factors. Latinx women face challenges with transportation and work responsibilities. Additionally, the high cost of services, lack of health insurance, and limited access to affordable care continue to make healthcare inaccessible. The feminization of poverty also sees disproportionate numbers of Latinx women in female-headed households as low income. Numerous laws prevent and limit undocumented individuals' access to healthcare. For example, the Patient Protection and Affordable Care Act, ACA, of 2010 excludes undocumented immigrants from purchasing health insurance. California's Proposition 187 from 1994 also prohibited public education and health services to undocumented immigrants. Various cultural norms center around family responsibilities targeted towards motherhood and domestic tasks. In addition to this, the language divide contributes to limited access to interpreters and information that is essential for access to healthcare. Our reflection question is, what are your own experiences accessing healthcare, and how do they affect you? To continue this discussion, these barriers to healthcare are manifestations of the anti-immigrant climate and nationalistic rhetoric. These lead to a distrust of institutions and numerous legal complications faced by undocumented immigrants. For example, a San Francisco study revealed that 75% of Salvadorian and 54% of undocumented Mexican women reported a fear of deportation as a primary reason for failing to utilize free medical services. This decrease in contact with the healthcare system leads to numerous secondary problems, particularly as women seek alternative treatments that aren't as reliable and lead to poor health outcomes. There's also an increase in secondary conditions, such as anxiety and depression. In the field of medical anthropology, the term structural vulnerability describes how a group of people experience adverse health outcomes because of their low position in society, exposing them to economic exploitation and structural violence. This connects to the framework of the Latinx women's experience, where race, class, and gender contribute to undocumented Latinx women being a structurally vulnerable patient population in clinical settings. Additionally, uninsured immigrant marginalization manifests in job availability and access to healthcare benefits and insurance coverage. This further discourages Latinx women from receiving healthcare. For example, while this graphic accounts for both undocumented men and women, it highlights the vast differences in insurance coverage rates between citizens and immigrants within the United States, with 45% of undocumented immigrants being uninsured. This presents challenges and effects, as previously discussed.
Continuing with the care framework, we will be discussing relations, such as the power relations through which she negotiates her path. We use this aspect of the framework to explore the situations and spaces where undocumented Latinx women navigate power relations and how these relations contribute to their experiences. Initially, I wanted to discuss Latinx women and their powerful vote. As we begin to explore Latinx women's participation in politics, it is important to recognize the stereotype associated with minority communities about unanimous voting that neglects the diversity in the experience and the backgrounds of the Latino community while oversimplifying Latino political contribution. Throughout numerous communities, Latinx women feel as if the COVID-19 pandemic was not taken seriously. This is amplified because Latinx women are often at a higher risk for infection because of the jobs they work. For example, Latinx women make up 14.6% of the hospitality industry, so they were at a higher risk of possibly getting the COVID-19. One of the observed trends has been more political participation as women are more liberated and invested in their political participation. In April, a fifth of women were pushing for the vote to be more democratically than men. 2019 elections showed historic participation, nearly doubling from 2014, with nearly 15 million Latinx voters casting ballots. In the past, Latinx women were largely considered apolitical due to their language barriers and the lack of information and communication about the voting process that often left them feeling insecure and nervous, with the common perception that their vote didn't make a difference. Although this election, there were numerous programs that focused on education, allyship, and community, which broke down many of these barriers. This relates back to our CARES model because it represents women feeling empowered through a collective action and the ability to influence political power relations.
The third part of our presentation will be looking at the connection between agency in the CARE framework and our proposed strategies for action. Agency was used when looking at the influence and resilience of undocumented Latinx women in the face of oppression, and it was used to explore the activism and agency that they hold. These strategies stem from what was learned throughout our research and relate to academic, legal, and corporate settings.
To begin with the legal system, to address bias and recognizing judges who may be showing discrimination is an important thing to recognize, and providing proper defense for victims. Also increasing understanding of the differences between immigrants and asylum seekers and the role that race and nationality play in people's perceptions about the likelihood of being granted entry based on these factors. Also making it transparent. There's tendency to hide the bad parts, which ends up silencing the voices of those who are hurt by these systems. Within the corporate system, fighting the privatization of detention, despite the Trump administration putting out a statement that they were going to get rid of private prison systems. This does not include private detention facilities and processing facilities. This is important because there's an incentive for people to keep people in these facilities as they receive money per person and how long they are kept there. Within the academic settings, educators who are going to be around children who are undocumented have the responsibility to listen to their experiences and be sensitive to all the additional responsibilities that they have compared with other children because of their situation. Elements of discrimination in school should also be addressed. Things like xenophobia, racism, classism, sexism, and homophobia that are still perpetuated in our education systems. Moving on from talking about immigrant communities as a statistic and instead humanize them as people, and integrating conversations about immigration into curriculums in schools to create more diverse narratives that highlight the voice of the oppressed while witnessing and listening. Our next reflection question is, what spaces are available for you to take action and make change? And what roles do you hold? Feel free to leave those in the chat. So our framework reflection, as we reflect back on the framework for the Latinx women's experience, which explores the intersections of race, class, and gender, and the CARE Women's Empowerment Framework that considers the agency, structure, and relations that affect their empowerment and experiences. We found these frameworks to be an effective structure for understanding the nuances Latinx women identities and how they are part of comprehensive cultural and organizational systems that privilege and oppress women of different identities.
And now I wanted to move into a personal reflection. Throughout the process of researching, exploring, learning in this presentation, one of the most impactful things we're seeing the resilience of Latinx women and their ability to continue to empower themselves and stand in solidarity despite the oppression that they face. Hearing Dr. Marquez's accounts of her own experiences and her research that continually push her to do and share findings that she collects was especially powerful. Additionally, the importance of telling stories and highlighting the perspectives and narratives of undocumented Latinx women especially stood out to me, and the role that this has in building a community and building change. And now we have our works cited. A lot of these sources were scholarly articles, websites, and as well as our interview. And we now wanted to open the floor to questions, but our first question to you are: what surprised you the most? How has your perspective changed? And how can you be actionable?
Edith, Edith and Carson, I was just looking in the Whova Q&A and I don't see any questions yet, but I think we can also encourage people to simply unmute and ask live questions as well, because I'm not sure our presenters can see the Q&A, and we've been dealing with so many technical difficulties that I think the simpler we can make this at the end, the better. So please feel encouraged to just simply unmute yourself and ask a question to follow up this really great presentation. Thank you.
So we do have one question. Can you hear me?
Yeah.
We have a question that says, I was dismayed to hear about the lack of due process in the immigration legal system. Can you speak a little bit about what you learned about due process?
Yeah, as mentioned, Dr. Marquez told us that there really isn't any due process, like you mentioned. They have lack of representation. Oftentimes, immigrants can't afford defense, so they sometimes have to represent themselves, and it's just a really long process that they end up just kind of giving up, and it's really sad. It is.
And to contribute to that, another thing that we found out in our research was that after someone has been deported, it can be 8 to 10 years before they're allowed to return to the country. And with that timing, it's so hard to continue a life that's already established, to continue to receive justice. And that just highlights how immigrant law is a system that's designed to oppress, depress, and break down immigrants and their search for justice.
The other question or comment in the box is that it's surprising that how multifaceted and fortunately deep the issue of immigration can impact women and children. And your presentation really brought that to light, that women and children are uniquely affected by the immigration policies that exist. Maybe speak a little bit about what you think might be ways to be actionable. I know you asked us to be actionable, but what are your thoughts? You're deeply involved in this, so what are your two ideas on that?
I think the first step to being actionable is using your voice and spreading awareness, and whether it's through a presentation like this and just spreading what you know, and with that comes educating yourself, because so much of what happens in this in the immigrant law system and the immigrant experience is not expressed. It's hidden behind legal documents, and like Dr. Marquez had to do, she really had to dig and find the sources. So educating yourself, and then also sharing your research and what you find, and sharing that awareness of that situation would be the first step.
So how do you see those of us that are in academia using this information and sharing this information?
To answer that, I would say that as academia, there's a responsibility to teach and to be conscious of what you're teaching and what perspective you're sharing. Like I was learning from the process, it's so powerful to share the narratives of undocumented individuals whose voices are so often silenced, neglected, and rejected. So as academia, using the platform that you have, using the reach that you have to share your voice and share a different perspective that encourages students, faculty, staff to think further, think beyond, and challenge their own perceptions would be that role.
So there's another question here that says, how can individuals help to better empower and support local Latinx communities, especially during election times?
Touching on the election times, I read that this last election, there was a lot more, I guess, like programs out there that really focused on the Latinx community and breaking down those barriers. You know, the language barriers and them thinking that their vote doesn't count. So really making them feel empowered and letting them know that they matter and their vote mattered was a good way to help empower and support them during the election time.
And another question came in, do you have a sense of the level of Latinx immigration in Iowa? Has access to healthcare been an issue for this community in Iowa?
While I don't have any specific figures, one thing that Dr. Marquez emphasized in her research was that a lot of times we think of immigration detention as a problem that is occurring in the southern US, although that is definitely not the case, and it is a nationwide problem. And to address that is just focusing on all these different communities and what you can do within at a local level, at a state level.
And then another similar question locally, what do you believe are the untold stories of Latinx women, especially students here on campus, that need to be told?
I would say to that kind of like I mentioned previously in the presentation, that there's a tendency to look at immigrants as their defining story is their immigration journey, instead of all the achievements that they have beyond that, their life beyond that. So in telling the stories and what stories need to be told, it is just looking at them as a person, looking at them as a whole being, and looking at them as someone that is a person and is real as a human that has a story that's just as worthy as anyone else's.
Dr. Maku has put into the chat an access to a link for an organization that works nationally to provide advocacy to support immigrant families and individuals as well. So a good place to start if you're wanting to take action.
Thank you for sharing that. I appreciate it.
So any other questions coming in, or anyone want to just unmute and ask a question? Please feel free.
Good morning. I just wanted to say thank you for this presentation and also for pointing out that this is a state government violence against women. So this is very important, that this is a structural violence and we don't talk about it. So this is really important. Thank you for pointing out that.
Thank you for that.
Thank you.
I'm glad we told you something that you appreciated.
So I think a related, but you didn't really touch on it specifically, but the DACA students and people that are in the DACA program, you want to speak a little bit about if you have any ideas about how they're impacted by all of these policies?
When we were actually talking to Dr. Marquez, she brought it up, and one, she didn't, while she recognized the great things that this program does, she also recognized that it was not a perfect program, and that how much commitment, how much monetary commitment, how much information has to be given to the government for this, and also how it's a temporary program, it's a 2-year, and how any legal misdemeanor can sabotage that whole experience. And so it's also the bait and switch kind of where one administration set it up, but one rejected it. And that caused so much uncertainty, so much fear, so much unknown for individuals who are relying on that program.
And here's a question for both of you. How has your research changed you personally?
It's really opened my eyes, and it's also really empowering, to learn more. And overall, I think it's just really good information, and it was a really good experience, and I'm glad I got the opportunity to do it.
I think for me, one of the biggest things was it challenged where I get my sources of information from and whose perspectives am I dominated by, whose perspectives am I listening to and accepting as truth. And in that process, it's realizing that I hear stories about immigrants. I hear stories about the horrendous acts that happen to undocumented immigrants, but I'm not connecting with them in that way. So one of the main parts of that would be the sources where I'm getting my information from. So making the conscious effort to be more aware of what information I'm consuming and how that shapes my perceptions.
So you mentioned COVID and the impact that had on changing a lot of this dynamic. And of course, there's the connection then to agriculture, which Iowa was deeply involved in. So in your work, did you find any sort of thoughts about how specifically the agricultural sector is impacted by these policies, and then the impact of COVID and all of that? What are your thoughts on those things coming together?
Mm-hmm. I think with COVID, we see that vulnerable groups get made even more vulnerable. And with the agriculture, they're considered essential workers and were forced to work during the pandemic, although the protection that they got was not up to standard with that. And as a result of that, so many more people got infected with COVID. And we see that there's a question of quality of life almost, and the worth of life, and how that all ties into how industries and corporations support the discrimination against undocumented immigrants.
If I can, I really liked your presentation quite a bit, and I also liked how you touched on colorism a little bit, because I don't think that's addressed enough. I was wondering if you had any research on how millennials and younger generations feel about media portrayals of them, especially when there's those colorisms and there's, you know, a vast array of representation of people in real life, but not necessarily through media. Have you done any research on that?
Mm-hmm. I would say, yeah, as well, both personally through this as well as through the ISCORE ISCORE class that we took last semester. Colorism definitely perpetuates the standards and perceptions of beauty in the in racial groups, and to have media representation be so significant, like Dr. Marquez is also saying, it's just like there's, for white passing Latina women and for Latina women of a darker complexion, it's just their experience is so different, and that the option to be that their race is, and people's perceptions of where they come from, who they are, that differences despite them being the same affected how they view their immigration status, how the threat that they felt to immigration procedures and policies such as ICE and the questioning, it's definitely like plays out too. And I think having more representation will always be more powerful, and that while we slowly see representation, we still have groups such as Afro-Latinx individuals where their representation, their categorization, their experiences and how people view them are still as a minority. And we have the questions where people question, are they even part of the Latinx group? So we still have a lot of room to grow in that regard and be more open to recognizing people with diverse backgrounds that may not fit mainstream perceptions of how Latinx individuals look.
Yeah, and unfortunately, I feel like the media negatively portrays the Latinx community more often than not. So it's important to challenge the media and really show the Latinx community as they are, which are people, and not in the negative light that they typically are.
We are nearing the end of our hour, so if there isn't any other questions, I think I'd like to congratulate Edith and Carson for excellent research and presentation today, and for hanging in there with our technical difficulties. So congratulations on your great work.
Thank
Wonderful
you.
presentation.
Yeah.
Thank you very much.
Thank you.